My name is Lindsey Shehee. I'm a head and neck, oncologic, and microvascular reconstructive surgeon here at SIU. Grew up in a small town in South Carolina, right outside of the Columbia, South Carolina area. My family, my parents, and my younger brother both still live down in the southeast. I met my husband when I was living in South Carolina, and then we moved here together to the Springfield area to work here for the department at SIU. Since we've moved, we now have a 5-month-old son who we've welcomed into our family recently. So I realized pretty early on that I was interested in pursuing a career in medicine. There are pictures of me growing up when I was a very young child with a Fisher-Price stethoscope and Dr. Bag kind of walking around the house. Thankfully, that interest never really waned as I moved through the rest of my educational background and ultimately decided to continue through and pursue medical school after college. During my residency training, I became interested in the care of head and neck cancer patients just by working with my mentors who also treated cancer patients. I really appreciated how they could bring a patient in for initial evaluation who was obviously very frightened and concerned about a new cancer diagnosis, but watching how they helped to calm some of their fears and answer their questions in a way that really helped the patient to kind of understand what was going on. And then getting to follow that patient through their cancer treatment, and then more specifically seeing the patient after they're done with their cancer treatment and they're in remission and we're in kind of a surveillance phase, and seeing the impact that my mentors had on the patients' lives when they had treated them for cancer was very impactful for me. And so I wanted to be able to form those relationships and establish that type of practice for my patients. So there are multiple head and neck cancer programs across the country, but we are very proud that we can provide true tertiary level head and neck cancer care to people here in Springfield. Myself and my partner, Dr. Harding, are both fellowship trained head and neck cancer surgeons, so we can offer both resection of the cancer and complex reconstructions for our patients here in Springfield. And those procedures, through both resecting the cancer and offering the ability to do these complex microvascular reconstructions, we offer the best form and function for our patients, not just immediately after surgery, but also long-term, when they're years down the road and living cancer-free.